Thank you. Thank you. So at AC Health, our vision is to create an ecosystem of different hospitals and clinics, pharmacies even, different access points now for our fellow Filipinos. But our mission is to provide every Filipino the right to good quality healthcare. And so to us, it's very important that those facilities, our facilities have the right staffing complement, both in terms of physicians and nurses and also allied professionals. So it fits in perfectly with our vision and our mission. And I always believe that the heart of healthcare is really the people behind it, no? And the people providing the service. And so we need to invest in building up the staffing and the human resource complement to support those facilities.
Thank you. There's a follow-on question. What are AC Health's expectations for graduates of this program?
We expect only the best. The heritage of Mapua and the combination with Sintana and Arizona State University, I think will create such a unique opportunity and platform for our students to truly be the leaders, healthcare leaders of the next generation. Well-rounded, very averse in technology, in a more holistic health training. I'm sure some of my colleagues here will agree, no, that that's where the future is. We need leaders who are healthcare leaders who are really not just kumbaga one-sided, no, but multifaceted, multi-skilled practitioners, and whether it be nurses or allied professionals or doctors. But we believe strongly in the tradition and the heritage of Mapua and the complementary technical competencies that Arizona State would provide, and we feel very strongly that the graduates that will come out of this program will truly be differentiated and well prepared to be leaders of the future.
Thank you, Mr. Borromeo. Yes?
For Dr. Santos, the Universal Healthcare Act of the Philippines was passed in 2019, but WHO were saying the earliest to be implemented on 2030. What do you feel are the stumbling blocks, and what's the actual situation in terms of how soon implementation can actually be done? Because we're always talking about Universal Healthcare Act and how it's going to redound to the benefit of the citizenry, but it seems there's a lot of stumbling blocks to that.
Thank you for the question. Universal healthcare is something very close to my heart, although I am not officially connected with the Department of Health. However, one of the biggest barriers to UHC implementation is really a lack of health professionals, the distribution of health professionals, the numbers of health professionals, in order to be able to staff the needs of universal healthcare really needs to be supplemented. And I think that's where the education sector really needs to rise to the challenge, because we not only need to provide enough numbers, but we need to provide practitioners who are trained and whose skills meet the needs of universal healthcare. And as I understand it, there are areas which are actually piloting universal healthcare, and we would like very much to be part of this journey. Thank you.
Follow-up question. But Mr. Romero was saying all the trained practitioners actually are looking for jobs elsewhere, leaving the actual profession that they've been trained for. So how do we alleviate that situation?
Another very difficult question to answer, sir. But definitely, we would like to have a lot of links with stakeholders who will be sort of the acceptors of the products that we graduate. And hopefully in this way, we will be able to match the needs of the workforce with the skills of the students, the graduates that we produce. And of course, we continue to advocate, for better working conditions, better compensation, and hopefully with all of these efforts, we will be able to provide a place for our graduates to work.
Would the scholarships tie them up in terms of commitment to have to be working within this particular system?
Yes, there will be a return service agreement that will be expected with the scholarships. And that's one of the many initiatives that we, in our PSAC committees with the President and the Department of Health, have been recommending return service arrangements. We've also been recommending different nursing degrees and programs, including for nursing assistants and nursing aides. Potentially shortening the master's program for nursing, so we have more teachers for nursing too. So there's many things on the table that we have been discussing with the Department of Health and with CHED. But yes, scholarships are a very important part of it. Students are the long-term solution. We need more students, we need more schools, and we need more students, and we need more groups to support those students in the form of scholarships.
Thank you. Yes, Anne?
Hi, I'm Jessica from Manila Bulletin. I won't stand na. But congratulations for this very good partnership. I have several questions. So first, this is for Mapua. I know you guys mentioned that
You just became a university back in 2016, so that's fairly young, especially in the field of science-related courses. So I know it's a good initiative. It's leveraging na itataas niyo yung game nyo in standard when it comes to attracting students na nagpipila ng school nila for health-related courses. But first question first, how much is the tuition for the health? Because I'm writing for education section. I'm sorry, so I have to narrow down these things.
With regard to the actual tuition, we can provide you with the specific numbers because the different programs have different tuitions also. But what we can say is that the tuition fee is benchmarked locally. So despite all the advantages of Arizona State University, the tuition is actually very closely benchmarked to local standards.
But is the a partnership with the international universities could affect actually tuition fee of the students?
That's actually what I was saying. Although there are benefits, the tuition fee has been locally benchmarked. So I guess you could say it's competitive tuition. Hindi po siya far away from the local standards.
And may we know how many students you have so far?
We have over 200 students in the programs that already exist. Those would be psychology, BS and BA psychology, and biology.
Let me write that.
For Ayala naman po, I covered some of the events of the AC, and I know the program is also for the young pa when it comes to competition of the health sciences. So what inspired you to partner with Mapua for this program?
Well, I think the vision that the Mapua group put forward along with Sintana was very inspiring. And their question was, how can we create a medical school and a health sciences school that can be differentiating for the future, leveraging, again, Mapua's heritage in technology, engineering, for instance. And I think we strongly supported it from the start, no? That there was, again, a unique offering that they could provide that is truly uniquely Mapua and uniquely Arizona State. So we were very excited about that. And to us, of course, we wanted to support and be part of the partnership, and we offered to provide our network as a training platform and also to provide scholarships to the group.
Okay, speaking of uniquely Mapua, we mentioned yung incorporating of technology with the health sciences. So ma'am, for you, how important it is na ma-leverage na natin of use of technology like AI into practicing it with the healthcare?
Definitely very important po because as we all know, technology has permeated into everything. It's in education, it's in health, and especially during the pandemic, this was accelerated even further. So we have electronic health records, telemedicine, electronic health, and these are skills that we need to teach our health practitioners so that when they enter into the workforce, they don't need to figure it out for themselves like my generation did, but they already have these skills embedded into the curriculum. So our aim is really to have practice-ready professionals, and digital literacy and digital skills are one very important component of that practice readiness.
Sorry, last question from you, ma'am. Do you have a target number of students to enroll, especially this year and then the next year, given that you have 200 now?
Yes, we do have targets. Are we able to share those targets? My understanding is that the nursing program, which is awaiting CHED approval, has a target of 48 students. and similar targets for the medical technology program, which has recently been opened, and the biology program, which is already running, but which we hope to grow together with the psychology programs in the future.
Thank you and congratulations.
Thank you.
Thank you for those questions. Do we have more questions from the floor? Yes.
Yes, hi. Sir Richard from Manal to Life. For Dr. Ray and Mapua, sorry. I'd just like to ask, aside from medical technology and nursing, have you also considered other medical courses to be part of the Mapua health sciences curriculum or courses?
Yes, we are aiming for a full comprehensive suite of different health professions. So what we have available now are psychology, biology, also master's degrees in psychology, medical technology, and hopefully nursing, as we hope to get the approval soon, will be offered this year. And in the next couple of years, we are aiming to also offer medicine and other courses such as PT, nutrition, and pharmacy. At the rate of around 2 or 3 programs every year. So we do have a bold and ambitious target, and hopefully we will be, together in this journey. And para sa bayan, because like Paolo said, we can't really prevent our students from choosing where they would like to go, but we can keep on producing and hope that they also help meet the needs of the country. Thank you.
Okay. Also, follow-up po about the BS nursing course. So it's still pending with CHED. So can you give us also an estimate that when will it be available? Is it probably the next semester or next year or this year? What is the target for this?
So we're actually, for the information of everyone, we're already visited by the technical evaluators and the regional quality assurance team of CHED and CR. So, next week, June 13, they're about to submit they will submit it to the CHED and bank for recognition. So we hope that next week we're going to receive the recognition. So it's not permit, but the whole recognition of the whole program.
I see. Okay. For my final question, so since there will be the medical courses in Mapua, will there be also changes in terms of let's say facilities that Mapua might need to add or change for their current existing university facilities?
So while we already have basic facilities for nursing, which we actually showcased during the visit of the RQAT from CHED Regional and the technical evaluator, we are going to develop the whole 7th floor of this building for learning spaces only for health sciences programs. And you will eventually see, now we will invite you again when this is already done, that these are fully immersive facilities, learning spaces, capitalizing on one of our pillars, and that is bringing in digital technology to the health sciences programs. So these are fully immersive, modern learning spaces, not very traditional compared to other learning spaces in other schools.
Okay. Thank you very much.
Thank you for those questions. Yes, ma'am?
Hi, good morning po. I'm just curious because I know that Mapua is into the quarter setup. Am I right? So, how do you think that will impact, especially nursing, since it is a very competitive course? Do you think that quarter, because I've been into the quarter system din, and medyo minsan parang mahirap kung maipasok yung within 3 months yung isang subject. Paano po yung mga estudyante na like may tendency hindi nila maipasa kagad or dahil hindi lang nila kagad naiintindihan on the first try? Do you think na okay po si quarter for the incoming na nursing because tried and tested na siya for the psychology one? So, curious lang.
Oh, well, the new programs, including nursing and medical technology, will still continue to follow the quarterly system. So, aligned with the principles of outcome-based education, of course, we are modularizing the curriculum and enhancing the curriculum with materials from Arizona State University. And the teachers are prepared to provide full guidance for the students as they navigate the different learning materials. And also aligned with outcome-based education, there will be expanded opportunities for achieving the outcomes should that become necessary. Thank you.
Yes, ma'am?
One thing about the quarter system is you take less number of units per term than the usual semester. So while the duration of the term is 11 weeks,
Yes.
you only have 5 subjects. Whereas if it were a semestral system, you may have 15 or 16 weeks, but you may have seven subjects to take care of every term, no? So there's more switching of gears in a semester system. So it's a trade of focus for speed. So so you'll cover the same materials, basically, same material, basically. Yeah. So the quarter system has worked for us already in engineering and IT and the other programs. So we think that it should work as well for nursing and the other medical programs.
Yes, I'm just curious po with regards to students na mag-enroll sa Mapua and then they would find out na hindi nila kaya kagad ma-absorb yung ibang subjects within the span of the term. So like, do you have specific na mga ways po para maka-catch up rin lahat ng students? Because as you said, gusto po ninyo na makatulong sa pag-improve ng nurses and ng medical techs dito sa Philippines.
As the dean said, we have adopted the philosophy of outcomes-based education. And one of the principles here is expanded opportunities. That means you give more chances to the student to to master the material. They move at different rates, di ba?
Yes.
So yung medyo mas mabagal, they'll be given more chances. And on the ground, what this means, for example, is we have a modular system of education, where a course will be divided into basically 3 modules. 3 modules. So, if you had a hard time with 2 other modules, but you passed already 1 module, you don't fail the course as a whole, but you're given more chances to catch up on the 2 other modules. Hopefully, the students don't get to use this a lot, but if they need it, it's an expanded opportunity to prove themselves to themselves, then they will have it under the outcomes-based system of education.
Thank you po.
Thank you. Yes, ma'am.
Follow up, I think not follow up but related question to what she asked. I'm a graduate of Pamantasan ng Lungsod ng Manila, and there's a
high bar when it comes to getting into the medical courses in PLM. So how high is the requirement or the standard of Mapua when it comes to accepting health and sciences students, especially scholars as well?
Thank you. Thank you for that question. This is actually still under discussion because there are a lot of trade-offs. When you set the bar very high, you exclude a large proportion, and these are trade-offs that have to be decided very carefully, considering a lot of different parameters and outcomes. So I definitely think this is a very important discussion to have, but we are still at the stage of deliberating on this. What is clear is that regardless of how we peg the entry, we will have a very strong curriculum to be able to allow more opportunities for students to enter into the workforce and not be sort of left out simply because of selection criteria.
Okay, and then another related to that, 4 terms, and then you have partnership with Arizona State University. So we gonna adapt based on that partnership and academic curriculum. And if yes, how?
That's correct. So one of the most powerful tools of the Arizona State University Consortium is the repository. So it's a huge data bank of a lot of materials, different types of materials created by the Arizona State University, and the scale of Arizona State University is to the thousands in their programs. So there are excellent learning resources and materials that are available. So selected courses for which this is applicable and relevant will be enhanced using content from the repository. So if you're familiar po, there are commercial repositories that offer these types of lectures. This lecture bank is already available as part of the consortium. So all of our students will benefit from the repository.
So
That's just part lang po of the partnership. No, there will be also an exchange student partnership that will happen.
Yes po. Again, a very good question. So exchange opportunities are available for our students in the Sintana programs, which include health sciences and the business program. So there are a lot of different permutations for short and long student exchanges. So internships, summer exchanges, both inbound and outbound, all of these will be available for the students.
Okay, thank you.
Thank you.
Thank you. More questions? Well, while we're waiting for the next question, Doc Maya, since you had mentioned curriculum, there's a question that was sent here that asks, what steps have been taken to ensure the curriculum adheres to the healthcare standards and requirements of both the Philippines and the United States? Healthcare standards of the Philippines and the United States.
What was the question?
I'm sorry. What steps have been taken to ensure the curriculum adheres to the healthcare standards and requirements of both the Philippines and the United States?
Thank you again for the question. So our aim, of course, is to produce practice-ready professionals who can practice in any setting, whether locally or globally. In the health professions, there are standards that are available. For example, the one that I'm most familiar with would be the World Federation of Medical Education, which covers all medical programs around the world. So we would be aligning with this and with other standards that are available for all of the different professions. So again, as part of our commitment to make sure that our students are ready to practice, regardless of the setting in which they may choose to go after graduation.
Thank you for that. Any more questions from the floor? Yes, Mr. Ayala.
I'm on the panel, but I will ask a question.
Go ahead, sir.
My friend Dr. Doma, Ray, and Dean Maya. So I think this partnership is really all about, this collaboration is really all about innovation, right? And I wanted to ask how this will really translate in a very tangible way for Filipino students, their actual student experience. How will it be different from the experience at other schools, and how are we able to do this in a way to our friend from the bulletin without increasing the cost that much? So when I say innovation, again, ASU is top 1% of universities in the world, has been ranked #1 in innovation ahead of MIT and Stanford for the last 8 years. And then in the case of Mapua, is one of the top 6% of all universities in the world, ranked one of the top 4 universities in the Philippines. And a lot of that is really about innovation. Dr. Bea coined the term DROID as part of our strategy. It's digital, research, outcomes-based, and international, right? So to be more specific, right, I'd like to ask if you could elaborate on, there's three pillars that come to mind, right? One is leveraging ASU's content and faculty, as Dean Maya alluded to. I believe ASU, for example, has the #1 online psychology program in the US, as an example, right? So how will students actually be able to leverage that? The second is Sintana, the Sintana Alliance of the 15 universities and growing. You heard Dr. Francisco Gutierrez speak. He has personally helped open more than 20 schools of medicine, schools of nursing, schools of veterinary, all over the world. And he's been able to take a lot of those learnings on technology, virtual, immersive, and given us advice on the labs that we hope to invite our friends from the media to see after this, not to see why they are so different and immersive. And then the last, I guess, is the use of technology, global classrooms, right, where our students will be able to participate with classmates from around the world and faculty around the world. So maybe Dr. Doma could start with just how does this translate into what we believe will be a very, very different experience. Not to mention, by the way, not to mention the partnerships with all of our partners here. Thank you to our partners for coming. And these are partners that were selected because of their innovative approach. For example, AC Health, all that you're doing in telemedicine and digital apps and all of that. So, Dr. Dom.
Okay, so let me enumerate, okay? I do not know whether I still remember the question. Okay, so, so number one, what are the things that we're going to get out of this collaboration with Arizona State University and Sintana Educational Alliance? So number one, as mentioned already by Dr. Maya, we have the ready access to the repository of thousands of materials from Arizona State University. To date, in our existing programs, we already enrich about 185 courses with materials coming from Arizona State Universities. These are already available to us to be included in our learning management system in deploying different courses in our existing programs. And for the upcoming programs in health sciences, we are going to use this repository in order to enrich our materials in delivering content. Number two, we already implemented what you call a co-lecturing program, wherein certain courses delivered by Mapua Malayan Colleges Laguna, and Mapua Malayan Colleges Mindanao joined in a particular course wherein the main faculty member is an ASU professor. So in this particular case, our students would have ready access to the first-hand access to the lectures of ASU professors delivered 100% synchronous via Zoom. So, so students, Mapua students at no extra cost can actually experience lecture courses delivered by ASU professors. Number three, we already implemented more than 10 global signature courses among Sintana Educational Alliance University. So we actually built in the second floor of this building a global classroom. It's a state-of-the-art classroom wherein participants in the classroom with technology like ceiling microphones can readily participate other classes in other Sintana universities without actually using microphones inside. So the people outside of the Philippines can actually readily create a semblance that the participants are in one classroom. So those in outside of the country and those in Mapua schools are part of one classroom because of technology. So we have already implemented several sessions of global signature courses. So we identified certain sessions in different courses wherein, for example, students in Costa Rica and students in Mapua can actually be in one classroom using global classroom venues. No? So each Sintana Alliance schools has a global classroom, and this is actually well equipped with technology such that it's very easy for faculty members to conduct sessions in Mapua schools and also sessions outside of the Philippines. So that's three. The fourth one is I already mentioned that we're going to build 7th floor with a completely immersive learning spaces for health sciences. And actually the idea in building this immersive learning spaces came from Sintana. No? So as mentioned by Fred, Dr. Francisco has successfully developed, launched about 20 medical schools in the world. And so we have ready access to these experiences, best practices from Sintana in order that the implementation of our new health programs are actually at par with world standards and actually immersive and modern. I think that's some of the things that we can, of course, the typical exchange programs wherein we can send students in all the parts of the world, no? Because we have Sintana Alliance networks in the Middle East, in Asia, in Central America, South America, North America, Europe. So you can only imagine that our students have ready opportunity to go to these countries to participate in short and long-term mobility activities.
I think we spent all our budget on microphones. Signature class. Anyway, well, long-term perspective, Mapua has never been shy about investing in quality education. In the 1960s, Mapua was the only private school, or the first, to have a mainframe computer. I think IBM 64 or something like that, not the best of the time. Also, well, we have invested in learning management system, industrial strength. And when the opportunity for the repository, the sharing of repository of materials came, and we actually needed a different kind of industrial learning management system, we invested so that the experience of the student would be seamless. They can actually go into the ASU repository and get the material seamlessly. Otherwise, there would have had to be some translation. And so we're not shy also. We're investing in this immersive laboratory. And we think that, if you wanted quality cost, then you'd have to invest. And that is, we're not shy about that, as I said. And earlier, when the YGC just acquired Mapua, we were the first to build a gigabit network. We built a gigabit network within 1 year of takeover. And that helped in the operation of the school, that helped in education, and so on, to have that kind of network. So that's the way we approach quality education. That I think it is the center of it is the student experience. So that's what you get from these health sciences programs. Yeah. Except for this
Thank you, Dr. Vea. Thank you, panelists, and thank you, guests, for your questions. We can